Anyone who has suffered from loneliness or social isolation will know it is a situation that seems impossible to overcome, leading to depression and low self-esteem. For patients, this can be a vicious circle that prevents them making any positive moves to help themselves. Leg ulcers and lower limb wounds are a hugely stigmatized condition involving lengthy healing times, extreme pain, lack of mobility, and social isolation.
There's around 700,000 people affected by leg ulceration in the UK, and that can be a range of issues that they have: arterial, venous. It could potentially be stretching down into the foot with ulcers and ulceration on the feet as well. And it costs around £1.94 billion to the UK economy and to the taxpayer.
Traditional management of lower leg problems and wounds such as ulcers sees patients attending leg clinics at hospitals and GP practices, or being visited at home by district and other nursing staff.
65% of visits from district nurses are to care for elderly and isolated patients with leg ulceration. That's a massive amount of time. That is 65% of their workload looking after those patients. And it's not getting smaller. The problem's getting bigger. That 1.94 billion is going to increase. These figures are only going one way, and something needs to be done about it.
Leg clubs are a psychosocial model which sees patients treated by nurses in non-clinical environments in concordance with strict clinical guidelines.
So a leg club is a social model for the better management of lower limb care, and essentially it's a place that people can go to have care for their lower limb problems, but also, importantly, it's a place for socialising. It's a place for people to spend time with health professionals, volunteers, and other people who also suffer with various lower limb problems. It's really important because there is a lot of loneliness, especially among older people who are experiencing these problems. And there can be a cycle where the problems stop them from going out of the house because they might feel uncomfortable, they might feel in pain, they might feel embarrassed. So by going to a leg club, they're given that opportunity to socialise with other people without shame or judgment, and to be supported both through the physical needs but also those psychosocial needs as well.
It brings people together and it empowers them to take shared care for their own wounds. They become involved, so they become responsible, and they take ownership of their wounds.
I think one of the big benefits of a leg club model is reduction of social isolation. The fact that members can get together, they don't feel like they're isolated, they don't feel like they have a stigma attached to them because they've got a leg ulcer.
What you have is a unique environment where you have patients who feel valued, who feel part of a community, and are getting the right care as human beings, not just as someone with a wound or with a leg ulcer or with lymphedema. They're treated as human beings in an environment where they can make friends and friends for life. And that's what I love about the leg clubs themselves, is it's a community. People who felt alone realize they're not.
Members are treated collectively, so no appointment necessary, which again makes it a very social thing to do.
I mean, you see it from the members' faces, really. Many of them are quite socially isolated, and you can see that coming to the leg clubs themselves. For many of them, that might be their only trip out of the week, but you can see what it means to them when they're all sat there laughing, chatting, and they all have a shared experience as well. And they all have similar conditions of legs, whether that be healed or in the treatment phase. I think one of the members from Leeds described it perfectly. It's the best thing since sliced bread. They can have a bit of banter with the rest of the members, and the actual model itself works really nice because all the members themselves are actually in a room together. So rather than the nurses travelling to every single one of their houses, they basically treat them one by one. So rather than spending half their time travelling, they can spend their full time treating and engaging with the patient.
So you have between 50 and 200 members per leg club, both in the UK and around the world. And they're going for advice, treatment, for fantastic leg regimen, and that social community, which I think separates it from everything else that's out there.
Catchphrase at the moment, the buzzwords, social prescribing. What can be done to support people living with leg ulceration, living with social isolation. What can be done to integrate them into a society where they can be with like-minded people and ultimately have their wounds treated and their afflictions healed. And it's really around that social prescribing. It's not about the dressings that are being used, it's around the environment that person's in. And that's the real key element to it. It's taking away just that real clinical wording and the clinical approach to it. What can we do with the social aspect of care as well? It's the holistic approach. It's not the whole in the patient, it's the whole of the patient that should be taken into account.
So the Leg Club model of care for members themselves basically gives them the ability or empowers them to understand what's going on with their treatment, to take an interest in their treatment, and then also once they're healed, to take an interest and empower themselves to make sure that they continue to be healthy and that they don't get a reoccurrence later down the line.
The healing rates are tremendous, and that's statistical fact. That's not me just saying because I'm part of the Leg Club. Statistical fact that the healing rates are better. Reoccurrence is extremely low, and that's because of this social model where once people are healed, they can still come to the Leg Club and still see the friends that they've made.
The evidence is already out there and shows that sort of it's significantly improved the care compared to sort of the way that it's been managed in the past, sort of through normal sort of routine ways, say via the district nurse at home or in, say, a GP clinic, etc.
I think it's a unique model that allows patients, clinicians and volunteers to work together for better leg outcomes.
So the Lindsay Leg Club Foundation gives proven standards that can be set across the whole of the leg clubs. That ensures that the standards are correct, that the treatments are that are being given are the right ones, and also that the support is there for the clinicians that have set up or helped to set up these clubs to make sure that they continue to access the treatments that are available and that are required.
The foundation's key. It oversees everything. It provides that overarching guidance around policy, around procedure, to ensure that all the qualities are consistent and maintained from leg club to leg club, whether it's in the UK or all around the world.
Social model of care. I think that's the key name and the key element behind it. It's taking away the isolation that people may face with leg ulceration. It can be an affliction that people can be a bit embarrassed about and something they don't really want to talk about with their family, their friends, let alone go into a clinical setting to have it looked at. So it gives people that opportunity to visit somewhere where they're with like-minded people having treatment for something which they might be a bit embarrassed about and don't particularly want to talk about. And that is the beauty of the social model of care. It opens it up to everybody. And it takes pressure off the NHS. We're looking at how having this available to people, it's sort of taking that pressure away from the NHS, taking those visits away from the district nurses, and really giving people a chance to have their leg ulcers treated effectively.
This wonderful social model where people continue to come, to pop in. It's not an appointment system. And I just think healing, great care, good efficiency of nurse time, improved healing rates, and this wonderful friendship that they build. It really is quite unique. Really is unique.